Children's Hospital is a really exciting place to work for many reasons. I think the biggest reason is the patients we get the opportunity to take care of. Their diagnoses really run the gamut of being some of the more common pediatric diagnoses that teach residents and fellows truly how to be a very good basic pediatrician, through some of the more complicated, uncommon diagnoses that teach us how to be a true diagnostician and take care of some of the more complicated illnesses.
There are 19 fellowships here at UPMC Children's, and our main highlight is that we have the infrastructure and environment to allow fellows to pursue their passion while facilitating a smooth transition from fellow to faculty. That passion, we acknowledge, can be in the realms of research, whether basic science, clinical, translational, or health service, advocacy, medical education, or quality improvement. This is all while fostering a diverse fellow population.
The value of having fellows in a training program like ours is really for the learning. We learn a tremendous amount from our fellows. Their enthusiasm, their energy, their excitement about learning, about taking care of patients, and keeping us posted on the most cutting-edge treatments and research. Yes, we train our fellows, and when fellows leave our program, they have extensive expertise in immunocompromised patients, in transplant patients, as well as common infectious diseases like meningitis, osteomyelitis, and sepsis. But having our fellows really gives us an edge as physicians and as faculty to think about why we do what we do. What is the evidence? What is the rationale? And the rich discussions we have with trainees really enhances the care that we provide to our patients.
In terms of my research career and the resources that the Children's Hospital and the Rangos Institute has, as well as the University of Pittsburgh has, probably there's 4 or 5 places in the United States and probably top 10 in the world that you have the resources that we have here.
And of course, we recognize as well that there are really 2 types of research that fellows are typically interested in. One is clinical research and the other one is more basic science research. So we try to accommodate our fellows in both of those aspects.
Our attendings are really great at giving us enough autonomy, but also enough guidance that I think not only do we feel confident in making decisions and being that first line for the providers, but I think it also makes the parents feel comfortable as us as a first line provider.
We have programs in virtually every discipline of pediatrics where our intent is to train pediatricians to become subspecialists to provide expert care in every discipline of pediatrics, as well as to gain skills in teaching and training and discovery. What provides hope for those children who don't have it now is learning new things about how diseases are caused, new targets for therapy, how to deliver drugs that we know work to the children who need them the most. And that's what we try and do with our fellowship programs. Institute superb clinical training, provide experience in teaching, and then the important cornerstone of our fellowships is intensive experience in research so that our fellows become trained in science and can make contributions to childhood health through discovery.
If you're considering applying for our program, I would urge you to come visit. The hospital is beautiful, the city of Pittsburgh is beautiful, the clinical opportunities are incredible.
There's so much about Pittsburgh to like. The food here is spectacular. The arts and music are amazing.
And game days on the north side, you can't beat that either. If you do like sports, Pittsburgh's a wonderful town, but if you don't, there's so much more to see and do, from plays and shows and everything. It has a little bit of for everyone.
I really feel like if I had the opportunity to go back and make the decision again, I absolutely would still choose to come to Children's for my residency and my fellowship training.